Have you ever stopped to think about how many signals your body emits while you sleep? The night, which should be a time for rest, can actually be a stage for silent symptoms lurking in the shadows and often going unnoticed. What many people don't know is that some symptoms of diabetes appear precisely during these hours, disrupting sleep and leading to serious consequences. And we're not just talking about intense thirst or persistent fatigue. These signs go far beyond what you'd imagine. Sleeping through the night, but still waking up exhausted? Feeling an unquenchable thirst that seems never-ending? For many, these signals may seem harmless, but in reality, they are precious alerts from the body. If you or someone you know has diabetes or is at risk, these interruptions could be signs that blood sugar levels are fluctuating more than they should. Recognizing these signs is crucial to finding the balance the body so desperately needs. What's curious is that many of these symptoms can be subtle and even seem commonplace in daily life. But those who know diabetes well understand that ignoring them is like leaving the door open to complications. Here, we'll explore each of these signs and understand how they affect the body. Discover what's happening while you sleep and how these nighttime symptoms can reveal a lot about your health. And if you're ready to learn more about these silent signals that diabetes brings during rest, stay with us and uncover every detail. For many, nighttime is a moment of rest, but for those living with diabetes, it's also the hour when silent symptoms may reveal themselves. Imagine lying down to sleep, only to experience a series of troubling signs like frequent urination, night sweats, and even polydipsia, the unquenchable thirst that forces you out of bed more often than usual. This isn't a coincidence, nor is it something to ignore. Quietly, the body uses these hours to signal what might be happening with your blood sugar. One of the most subtle yet revealing signs is a constant feeling of fatigue. It's as if, even after a full night's sleep, the body remains exhausted. This might seem like regular tiredness, but for those with diabetes, it can be the first alarm that glucose isn't being processed effectively. So, how can you tell if your body is sending these signals? Pay attention to those nights when you wake up thirsty or feel the need to urinate more frequently. If this is happening often, it's time to observe more closely. What's intriguing is that these symptoms are so subtle they can go unnoticed, blending into the rhythm of daily life. Sometimes, chronic fatigue is mistaken for stress, night sweats for the room's warmth, constant thirst for a dry day. But for anyone truly wanting to understand their body, identifying these signs is the first step toward a more conscious approach to health. A practical tip: try keeping a journal of nighttime symptoms. Recording what you experience at night can help you spot patterns and make it easier to identify an underlying health issue. If nighttime discomfort is recurring, it may be time to reflect on what might be happening. As diabetes takes hold, it manifests almost discreetly, and many don't see the connection between poor sleep and larger health issues. This disconnect can delay someone from seeking help or even realizing that these nighttime signs might be related to uncontrolled blood sugar. The key is noticing and understanding what the body is trying to communicate as you rest. These nighttime signs are not merely inconveniences. They have a purpose and deserve special attention. After all, if something can help you avoid complications in the future, it's the ability to recognize these signals in the present. Each symptom is like a puzzle piece that, together, can lead to an answer for more balanced health. And by recognizing these signs, you open the door to understanding why certain nighttime behaviors, like frequent urination, occur. Frequent urination at night is a signal your body sends to show that something might be off. Most people have experienced waking up in the middle of the night to use the bathroom, but for those living with diabetes, this can become a frequent and disturbing event. When glucose levels are high, the body tries to expel the excess through urine, leading to the need to wake up multiple times to empty the bladder. However, this constant routine can disrupt sleep and affect the quality of rest, only worsening fatigue the next day. Understanding this dynamic is essential for those seeking a more peaceful night's sleep. Waking up repeatedly to urinate may not seem serious, but in the long run, this constant interruption hampers both physical and mental recovery. Imagine sleep as charging your phone battery. Each time you get up to use the bathroom, you interrupt the charge, leaving the battery only half full. The body feels the impact because deep rest, crucial for balancing various functions, is interrupted again and again. So, how do you know if this is truly a sign of diabetes? There are a few practical ways to observe. If the need to urinate at night persists for more than a week and is accompanied by other signs, such as excessive thirst or next-day fatigue, it's advisable to consult a doctor for further evaluation. Additionally, trying to reduce fluid intake after dinner can help monitor your body's behavior. Paying attention to these small details can provide valuable insights into your health. For many people, frequent nighttime urination can be bothersome, but ignoring this symptom may be even riskier. The sooner it is identified and addressed, the better the chances of avoiding future complications. If you're already wondering whether this might be happening to you, pay attention over the coming days and note how many times your sleep is interrupted by this urge. Each trip to the bathroom could be revealing something significant about your body's health. So, the next time you get up at night, consider if this has become a constant and bothersome issue. Understanding what your body is communicating during these nighttime moments is part of knowing your health on a deeper level. And as new signs appear, like night sweats. Night sweats can be a silent nuisance, but for many, they're one of the most telling signs that something is happening with blood glucose levels during the night. When blood sugar drops drastically while we sleep, the body reacts automatically, releasing emergency hormones like adrenaline to try to rebalance levels. This is when intense sweating begins, often waking a person up in the middle of the night, uncomfortable and frequently without understanding why. If this happens often, it could be a warning that hypoglycemia is present and needs attention. The feeling of waking up with damp skin and wet sheets is uncomfortable, but more importantly, this symptom shows the body is on alert. It's as if the body is saying, "I need help." In this case, night sweats are a reflection of the body's effort to stabilize blood sugar, and this constant fluctuation can impact mood, focus, and energy throughout the day. Taking steps to prevent large glucose variations before bed, such as having a balanced snack, can help manage these episodes. When we think of night sweats, the first reaction might be to assume it's related to warmth, room temperature, or even stress. But if you have diabetes or are at risk, this reaction may have a deeper and more relevant explanation. Many healthcare professionals recommend checking blood glucose levels before bed to understand if there's a tendency for significant drops at night. This way, you can identify whether the night sweats are indeed linked to hypoglycemia. To manage these episodes, there are some practical strategies that can make a difference. Keeping a journal where you record the times when sweats occur and any dietary habits before bed can help identify patterns. Additionally, keeping a small source of sugar beside the bed, like juice or candy, can be useful if levels drop and you wake up feeling weak or sweaty. Small preventive actions can ensure a more peaceful and safe sleep. So, if night sweats have become part of your routine, it's worth paying attention to how your body responds and exploring ways to minimize discomfort. And as we keep an eye on these signs, other symptoms, such as sudden hunger in the middle of the night. Nighttime hunger can be one of the most surprising symptoms for those experiencing low glucose levels during sleep. When glucose drops, the body signals that it needs energy, and sudden hunger is one of these reactions. Imagine waking up in the middle of the night with an uncontrollable urge to eat something. It's not just a craving, it's almost a necessity as the body is trying to stabilize glucose. This symptom may be accompanied by blurred vision and even mild mental confusion, making it harder for someone to understand what's happening. These nighttime hunger episodes often leave people questioning the actual cause of the symptom, as the urge to eat during the night can be mistaken for other eating habits. However, hypoglycemia stands out due to the urgent need to replenish sugar, as if the body is demanding a quick fix. To alleviate this, some specialists suggest light, balanced snacks before bed, rich in protein and fiber, as these help maintain more stable glucose levels throughout the night. This sudden hunger is also a symptom that connects to other health issues, such as the impact on sleep quality. Getting up to eat disrupts rest and can create a cycle of fatigue and tiredness throughout the day. For those living with diabetes, addressing these signs is essential to maintaining well-being. It may be helpful to have food options that raise blood sugar quickly, like a small portion of fruit, which is a practical and healthy way to manage nighttime hunger caused by hypoglycemia. When glucose levels drop suddenly, a person may also feel confused or disoriented, making it even harder to determine what to do. In such moments, it's common to think the hunger is temporary, but for those facing frequent episodes, knowing how to recognize the symptom and act quickly makes all the difference. In some cases, keeping a small note of how you felt when waking up to eat can help identify patterns and communicate these symptoms more effectively to a healthcare provider. If you've been getting up to eat during the night, it's worth observing whether this habit might be related to possible hypoglycemia. Paying attention to details is part of deeper body care, especially when it comes to nighttime symptoms. And while this unexpected hunger can be challenging, other signs, such as the urge to move your legs restlessly. Restless leg syndrome, RLS, is one of the most bothersome symptoms for those living with diabetes and can be a real barrier to restful sleep. This uncomfortable sensation feels like an internal itch in the legs, only relieved by movement, even if it means losing precious hours of rest. Peripheral neuropathy, a common complication of diabetes, affects the nerves, making the need to move the legs almost involuntary. Although this symptom may seem small, it speaks volumes about the condition of a diabetic person's nerves. Imagine being in the middle of the night, trying to sleep, but your body simply won't allow you to relax. Those who live with RLS know how exhausting and frustrating it can be. Many describe the sensation as tingling, or even an internal tickling that stops temporarily only with movement. This symptom directly affects sleep quality, creating a buildup of fatigue that, over time, compromises daily energy levels. For some, finding a comfortable position is a real challenge, and the night becomes a struggle to relieve the discomfort. So, how can you manage it? Experts recommend a few practices that may help ease these episodes. Gentle leg massages before bed, for example, can reduce tension and relax the muscles. Another practical tip is to include some regular physical activity in your routine, like walking or stretching, as controlled movement during the day may reduce the urge to move the legs at night. Additionally, maintaining a calming bedroom environment with low light and sound can facilitate relaxation and lessen the impact of this symptom. Restless leg syndrome also reveals something important about nerve health and the impact of diabetes on the body. Peripheral neuropathy, which affects extremities like the legs and feet, not only causes discomfort but can also influence sensations of pain and temperature. Therefore, any persistent discomfort should be taken seriously and discussed with a healthcare professional, as nerve care is essential to preventing more serious complications. If you've noticed restlessness in your legs while trying to sleep, it may be your body trying to communicate something. This signal could be the first step in understanding how diabetes affects the nervous system and circulation. And as you consider strategies to ease the discomfort, there are also other nighttime signs, like sleep apnea, that might appear. Sleep apnea is a condition that goes far beyond simple snoring. It involves repeated pauses in breathing while we sleep. Imagine being in the middle of a dream, and without realizing it, your body stops breathing for a few seconds. It's as if the body is struggling to capture oxygen, waking you up, even briefly, to catch your breath. For people with diabetes, this condition is especially concerning, as sleep apnea is associated with obesity and insulin resistance, both of which already require careful management. For those dealing with this condition, sleep quality is significantly compromised. It's common to wake up tired, even after spending hours in bed, because the sleep is not continuous. This fragmented sleep leads to chronic fatigue, affects mood, and can even impair focus throughout the day. If someone around you has noticed loud snoring or pauses in your breathing, it might be time to pay attention to these signs. Sleep apnea is more common than many think and should not be regarded as normal. Interestingly, there are some practical ways to manage sleep apnea that can help alleviate the symptoms. Weight control is one of the most recommended measures, as obesity significantly increases the risk of developing this condition. Additionally, sleeping on your side instead of your back can help reduce the frequency of breathing pauses. Another option is the use of devices like CPAP, which provides a continuous airflow to keep the airways open during sleep. Sleep apnea is one of those conditions that many ignore but has a profound impact on overall health, especially for those with diabetes. Its connection with insulin resistance means that the body is under constant stress, and poor sleep quality only worsens the situation. Sleep is essential for regulating metabolism and supporting proper insulin function, and when it's repeatedly disrupted, the body bears the consequences. Paying attention to these details is a way to prevent complications and ensure better quality rest. If sleep apnea has been a challenge in your nights, it's worth considering a conversation with a healthcare professional to evaluate the situation. And while you explore ways to improve sleep, other nighttime signals, like increased thirst, might also be trying to communicate something. Waking up with intense thirst and a dry mouth can indicate that the body is dealing with high blood sugar levels. This symptom occurs because when glucose is elevated, the body tries to flush it out through urine, resulting in dehydration. For those with diabetes, nighttime thirst can become a cycle. You hydrate, but the water is quickly expelled, which affects sleep and increases fatigue the next day. Avoiding carbohydrate-rich meals before bed and keeping a water bottle by the bedside are simple adjustments that help ease discomfort. Persistent fatigue is also common. Even after a good night's sleep, many still feel tired because the body can't effectively use glucose to generate energy. This fatigue can affect motivation, mood, and productivity, bringing an emotional toll. Small changes in diet and short breaks throughout the day help reduce this exhaustion. Dry mouth, another uncomfortable symptom, worsens at night as the lack of saliva allows bacteria to grow, increasing the risk of oral health issues. Using a humidifier in the room and avoiding salty foods before bed help reduce dryness. Sleep disturbances and insomnia also affect those living with diabetes, as the body struggles to balance glucose, making restful sleep difficult. Maintaining a relaxing bedtime routine and avoiding heavy meals helps stabilize glucose and promote deeper rest. Observing nighttime symptoms and adjusting glucose management is essential for a more balanced and energized life. Now that you understand how diabetes can manifest while we sleep, the question is, what will you do with this knowledge? These silent symptoms, which often seem harmless, are your body asking for attention. If you've noticed any of these signs, why not start observing them more carefully? It's not just about improving sleep, but about taking a holistic approach to health, recognizing each detail as part of a larger picture. Every step you take can be a step towards better glucose control and a more balanced life. As you go to bed, remember, small actions like adjusting nighttime meals, drinking water in the right amount, or keeping a symptom journal can make all the difference. Think about what you could start implementing as soon as tonight to see real changes. Speaking of more knowledge, have you checked out our video on frequent heartburn? The cancer warning sign no one talks about? It will further deepen your understanding of the body's signals and how small changes can transform your routine. Now, we want to know, have you noticed any of these signs? And what are you willing to do to improve? Share your thoughts in the comments, subscribe to our channel, and turn on notifications to keep exploring practical tips on diabetes and health. Don't wait to give your body the care it deserves, because every detail matters for a healthier, more fulfilling life.